Hey guys, I'm going to review the Aspen collar with you. So these are our patients with cervical neck injuries. So they've got pain, they have muscular injuries, or they have a cervical neck fracture of some type. They will be ordered for an Aspen Vista. A couple of places you can find these. 41 North and the Sticky are going to be your best bets. The ER and OR have their own supply. So please, if you're not working in one of those units, go to 41 North or the Sticky. Please, please, please bring a patient label. This is one of the few pieces of equipment that we directly charge to patients. It's durable medical equipment. So in the bag with the Aspen, it's going to come with some extra pads, and it's also going to come with a form. That form has to get a patient label attached to it and turned in to the unit supervisor of that unit. If not, we cannot order any more. All right, so you've done all of that. You bring this to your patient's bedside, and to place the Aspen, this is your front piece, this is your back piece, okay? Someone is going to need to hold neck if this patient is to be maintaining spinal immobilization. So I will hold the head like so while I push down on my bed. Some of the beds upstairs especially are a little bit cushionier, and you're gonna place this piece back behind the patient's neck. These straps should come about halfway in between my ears and my trapezius muscles right here, just like so, all right? Then I'm going to have the front piece like this. This is one size fits all. We do not have to measure, so you're not throwing away extra collars because you measured improperly. You're gonna make sure that this is in the lowest position. Starting right here around the xiphoid process, I come up and over to the neck, all right? Tucking this front piece into the back. Okay, so again, getting kind of close up with my patient, just like so, all right? Y'all might not be able to see it on here, but I have some gap right here. I don't want that, all right? So I'm gonna take this knob, pull it up towards the sky, over towards the right. Y'all see how it's moving upwards? All right, so that's probably a little high. This is about right where I want it. I want this patient to be able to open their mouth, eat a good meal, not a cheeseburger, but they need to be able to open up their mouth, just not as wide as eating a cheeseburger or something like that. All right, that's placing an Aspen collar, okay? A couple of things that you'll need to do as far as skincare. Once a shift, you're gonna remove this collar altogether and perform hygiene. Make sure it's clean, it's dry. Make sure your patient knows that they should be doing that for when they go home. They need to keep this area clean and dry. We've seen some HAPUs develop, especially down in this area on the chest and not right underneath that chin. Another thing you're gonna do once a day, okay, so skin checks once a shift, so everyone should be doing that, but once a day, you're gonna take your brace off and remove the pads, okay? When you remove the pads, you're gonna insert the new pads that you had, right? So pretend these are my new pads, and I'm gonna place it back on my patient, okay? Meanwhile, I'm gonna take those old pads with soap and water, wash them, dry them, and that's what I'm gonna use tomorrow when I come back and do my pad care again. Very important that you do that and that you teach your patients to do that because they're going home with these devices. All right, and that is your Aspen collar. Thank you.